Good evening, everyone. My name is Sharon Moreno, and I'm a family nurse practitioner. I see patients over the great state of Texas via telemedicine and physically in the Rio Grande Valley. We are Gold Rush Health Solutions, and tonight's segment is Navigating Medicare. We have a special guest today, Erasmo Yarrito Jr. Erasmo, welcome. Tell us a little bit about yourself.
Hey Sharon, how are you this evening?
I am great.
Good, good, good. So thank you for having me on. First and foremost, I'm a licensed agent or broker here in the Rio Grande Valley. I'm with Five Star Financial Services LLC. It's an agency that we created a few years back, actually, and so I've been a licensed agent for that number of years. Our primary business is Medicare, and so that's what we focus on. Even though our license allows us to do other things, but our primary focus is Medicare. That's what my primary is with my clients as well. Um, so prior to becoming that, I did work for the state of Texas for 25 years, and or 24 years that is, and I was in the United States Marine Corps Reserves here in the Rio Grande Valley as well, way back when right after graduating high school. So my wife and I have gotten a chance to move around and stuff, and during my career with the state and the federal government. But my passion really has been being a licensed insurance broker because what I'm able to accomplish, and I feel that I'm able to accomplish a lot by helping people. And one of the reasons why I became an agent was because I was seeing the discrepancies in how my mom and dad were being treated by their Medicare representatives, or Medicare Advantage representatives, and they were changing them every year from year to year without any cause. They didn't. There was a lot of things with that I thought you don't have to change every year. And I know that people have that myth. I need to change my Medicare plan every year. It's because that's what my agent says, and I hear agents say that, and I cringe because you don't. If you're happy with your plan, and you're feeling good with your plan, and you like your plan, there's no reason to change your plan. You can stay on your plan, but people are told that time and time and time again. So that's the reason why I really, when I left working for the state of Texas, I became an agent so I could guide my mom and dad and other relatives to ensure that they had the proper benefits, what they needed to have, and kind of look out for them. And so that's turned into where we're at now. I've been in this location here in Harlingen, at the address that's on the screen there, for 3+ years now. I decided to open up a brick and mortar way back then, and it's really been nice to have an office, to have my clients have a place to come and visit and chat and describe the issues that they're having, and so there's a lot of things that happen to our senior population that shouldn't be happening if they had a good representation or good agents that and that there's a lot of
Absolutely.
them out there. I'm not saying that there's not, but they just need to be there for their clients. So I'm ready to get started whenever you are, as far as the that's about me anyway. So
Absolutely. Thank you. I think that this is going to be a very good segment. I'll be honest, being in the clinical side of things, this is an area where I have a big knowledge deficit, and really whatever I have learned has been from you. So thank you. I appreciate everything, the guidance and everything that you've given me, really makes a big difference. And the question is, why did I learn? Again, because of aging parents as well. Things don't always become important to you unless it greatly affects you. And I didn't really think much about Medicare because, again, I'm a clinical person. I prescribe, I diagnose. I'm like, this is what you need, and that kind of was like, here it is. This is what you need. But I really wasn't thinking about, okay, how are people getting things covered and all of that stuff. And I didn't realize that there was a bunch of complex things going on in the background with Medicare until I started to suffer those things with, again, my own aging parents. So I know that this is going to be a great segment. Guys, I'm working on choosing topics that are extremely pertinent to our community. These are free talk shows. If there's topics that interest you, then, uh, it's important to say something. You can either, place it in the comment section or send me a private message. These sort of topics are important because it affects our livelihoods, not only your livelihood, but loved ones' livelihood. I'll start with our legal disclaimer again, give you an opportunity to read over that, while you're gathering some ideas regarding important topics. I do want to mention I did miss 2 segments for 2 weeks. I was, a bit under the weather and dealing with some issues, but I'm back at least for now. And have a couple of segments planned in the near future. So again, thank you for being patient with me, my patients as well. Thank you for also being patient with me. I know it took me a little while to respond to certain things. I know sometimes healthcare people are seen as superheroes, but we also have our own personal issues and we also get sick sometimes. So thank you for your patience. All right, Mo, let's get started. Start with whatever you feel is important.
Okay, well, Medicare. So let's start off with Medicare first and foremost. It's a program that was created in 1965 by our federal government, to assist our elderly population. And so the way it works right now is when you qualify under Social Security, what I mean by qualify, you have to have at least 40 quarters of working, which is 10 years, so that you can be eligible when you're turning 65 to get Part A and Part B. So it's a two-part prong system. You got to have Part A that comes automatically to a lot of folks that turn 65, because there's a lot of our folks that are still 65 that are still working. So they get notified by Social Security sometimes and say, hey, here's your Part A, because you don't want to have your Part B. And some folks can go ahead and defer their Part B until they're ready to retire, and that's fine. So there's Medicare Part A and Part B. And a couple of years ago, there was a big push out there, and you may have seen some of the advertisements. This was before the Joe Namath thing that came out and J.J. Walker, or maybe it was right after. Anyway, a lot of folks were hearing this. Do you have Part C? And if you don't have Part C, you don't have a true Medicare Advantage plan. And when I heard that, I cringed. I'm like, wait a minute, what are you talking about? Part C is the plan. So the way it works is you get Part A and Part B from Social Security, right? When you're eligible and you get them, you do have to pay a fee for Part B. And as long as you don't have a business, you're not a business owner, and you're making, $200,000 or $300,000, $400,000 a year, you don't have to pay anything extra than what the normal fee is, which is right now is $185 a month coming out of your Social Security check for Part B. Part A is free. So when you get that and you go and you get an Advantage plan or a supplement, then you're tacking on that C. They'll tell you got to have Part D as well. Part D is your prescription drug plan, but the prescription drug plan is included in the Part C package, if you will. So a Medicare Advantage plan contains Part A, Part B, and Part D, and they call it Part C. They wanted to really confuse people, I think. So that's why they do that. On a Medicare supplement, that's a little bit different. You're going to pay monthly for a Medicare supplement plan. And so that you just need to have Part A and Part B to qualify for that. You pay monthly for that. You also have to pay for your prescription drug plan if you're going to get a Medicare supplement. There's some other differences between that, and I don't want to go too far off in the weeds on the supplement just yet. I want to continue to talk about Medicare Advantage and Medicare. So you may also not make enough money, and they would qualify you for potentially assistance through the state. The state can offer you Medicaid with a D, not Medicare, which is the RE. Medicaid is a program that is run by our individual counties, and you have to go to the food stamp office or the Texas Department of State Health Services, otherwise known as the food stamp office, and go apply for Medicaid if you feel that you don't make enough money. Their qualifications change on a regular basis, so I don't know any of the numbers, but if you make less than $23,000 a year combined income in the household between you and your spouse, or if you're by yourself, then you possibly do qualify for Medicaid. So you can go down to the Medicaid office and maybe have a loved one go with you, or you can apply online, and I have some websites for you. But you go and you go ahead and apply, and then they tell you in about 2 weeks whether or not you qualify. And that's some good assistance. It's not, there's no shame in being qualified for Medicaid, because if you qualify for Medicaid, you're going to get all the benefits you need. You're going to get a plan from the state. There's three companies right now that have those plans. One is Molina, the other is United Healthcare, and the third one is Superior. And all three of those are administered by the county through this, or by the state through the county. And you have a plan with them, and you're also entitled to have a Medicare plan for your Medicare portion that you get. So you actually will have two plans working in conjunction. And there's some new rules coming up in 2026. They're going to say you have to integrate those, and I'll cover that in a little bit. But when you get ready, when we start talking about integration, it's mainly going to be in 2027. But Hidalgo County is going out there and trying to really get things going, and trying to work with getting their clients already qualified. So they're telling them you have to integrate very soon, so that by 2027, which is only 1 year away, actually, when you look at it, because AEP is real close, right around the corner from now for 2026, then they'll be ahead of the game on that. But there are some qualifications that we can talk about. Now, if you want to go ahead and apply for Medicaid online, if you have a loved one that can help you, or if you have a loved one that's already on Medicare and you want to see if they qualify for Medicaid, you can do it really easily at www.yourtexasbenefits.com. That's yourtexasbenefits.com with triple W in front of it. That takes you to the Texas Department of State Health Services, and you click on Medicaid, not the food stamps portion, and you can go ahead and fill out the application that way, and you can get it all going. So that will help you get some more benefits, if you will, and get you going with that. Now, there's one other way that you can be assisted, and it's not Medicaid. It's through the federal government. It's through the Social Security website, ssa.gov, and that's called low-income subsidy. The low-income subsidy, I encourage everyone to try to apply for that, because if you are making, and I believe it's like 25 or 27,000 for a married couple, less than that for a single individual or a widower, you may qualify for low-income subsidy, and they also tell you in about a week or two. But when you go on there and apply, that has nothing to do with Medicaid, but it's a low-income subsidy that you're entitled to just because you are already on Social Security, and you can get benefits like having your prescription drugs paid for. You can get your Part B paid for. So there's some very high cost items that you would no longer have to pay if you qualified for a low income subsidy. So there's that as well. So you got your Medicaid, you got your low income subsidy, and if you qualify for all of those programs, then we have special plans that are Medicare Advantage plans that you qualify for. And depending on what kind of benefits or additional benefits you want, and like right now, 2025, there was a food benefit that was going out to folks. You got a card, you got your card for medical, and you got a card for a food benefit where you can go to Walmart, you can buy groceries. And so folks were elated with that because the numbers were high. I have a little bit of bad news. Next year in 2026, those food cards are pretty much going away for most companies. There's going to be one or two companies that are going to have them. And there's going to be another qualification that's going to happen, and that's called the let's see, I want to make sure I get this right. It's a supplemental benefits. Wait. Let me repeat. Special supplemental benefit for chronically ill, and it's SSBCI. And if they qualify for the SSBCI and they're on dual, which is Medicare, Medicaid, for 2026, then there's a great chance that they're going to be able to qualify for a food benefit depending on the company that they choose, the company being carrier. And in the Valley, we have about 8 or 9 carriers. We are very fortunate here at 5-Star Financial that we do represent all of those carriers. So, we have an opportunity to be able to guide our clients and put them on the plan that best suits them. Unlike other agencies where they only have an agenda, it's just from what I saw when I was coming through the ranks. And I also, when I first started, I was a captive agent with United Healthcare. So all I could represent was United Healthcare. Mm-hmm. But then I learned my my ways about 3 years into it, and I said, okay, it's time for me to become a broker. I'm very grateful for the time that I got to learn everything from United Healthcare, but that only gave me a little bit more leverage, if you will, on the other companies, because now I already understand all of that. So I encourage you, for all of you that are already on Medicare and you have a Medicare Advantage plan and you have an agent that you know, get with your agents. Get with your agents after October 1st to make appointments with them and talk to them. I'm not here to try to convince you to come to us, but I am going to tell you that we are your full service agents. And if you do have issues with your agent, that you call them and they don't answer, you call and ask questions and they don't return your phone call, give us a call. Our information is on that sheet that Sharon showed. But there is that for the Medicare, and on the Medicaid side, we definitely can guide you with that as well. I think
Jose says, great information. Thank you, Jose Rangel.
awesome. Thank you, sir. So as far as Medicare Advantage plans in the Rio Grande Valley, they're not. A lot of people say they're just cookie cutters, and they're not. They're not. They are all different. We have right now under Five Star's belt, we are representing about 46 different plans from the 8 different carriers. So you really need to have time to sit with an agent and figure out which is best for you. I don't think that, as much as I love the internet and as much as I love people who like to go out there and do it on their own, I honestly don't think that you can go online and figure out these are the benefits I need. I know Medicare sends you that book. It's about 2.5 inches thick that everybody got. You can't look through that book and decipher and figure out what's going to be best for me. You can look at things and say, I like it, but take that book with you and go talk to the agent and say, listen, this is what I was looking at. Is this going to be to my benefit? All too many times, it's happened with me as well when I go visit folks, and they're telling me they want to be on this certain plan, and I'm like, awesome, let's get you on this plan. And then I start asking about their medications, and I find out they're taking like a metformin. Well, you didn't tell me you were diabetic. Oh yeah, I'm diabetic. Okay, so if you're diabetic, that's a different plan altogether. And those chronically ill plans that are offered by, let's see, about 4 companies for chronic conditions, you pay so much less. Your formulary is so much bigger, which what I mean by the formulary is your prescription drug area is so much bigger that it's covered better and easier for you than if you are on a regular Medicare Advantage plan, because those formularies are a little bit tighter because they're designed for people that are in good health. So, if you have a qualifying condition like diabetes or a heart condition or cancer or something like that you may have be experiencing, let us know so we can try to pre-qualify you for one of those plans as well, and not just us but your agent, and that way they can look into it for you, because those you can actually get into those all year long. So let's say you're all healthy, and then all of a sudden in March or May you go to the doctor and they say, hey, you're pre-diabetic, you need to start taking this medicine, or you have a clogged valve, we need to give you this medicine for your heart. Now it's time to talk to your agent again and say, listen, I just got prescribed this medication. Can I get onto a chronically ill plan so that I can save more money? And it's a significant savings if you get admitted into the hospital to go see the primary care. Usually your primary care doctors are all at zero, depending on the plan. But the specialist is a big thing, because some of those plans are $35, $40. And on the chronic ill plans, they're only $10 to $15. You're saving a lot of money right there. So it's really nice to be able to reach out to an agent and say, hey, listen, I have this situation, and that they listen to you. I know that the agents that work with us, they're all in it for helping people, not for anything else but to help. And so we're only a few with Five Star. We're a total of 6 agents under our belt right now, and I'm very selective with who I pick, because I want them to be able to really care. I don't want them to be only after the money. Not that we make a whole bunch of money, but it's one of those things that some people say, oh, you guys are rich. No. It's a lot of work, but we enjoy it. All of our agents enjoy doing what they're doing. So there's that. Now, let me go back a little bit, if you don't mind, to go into the dual, which is the Medicaid, or Medicare. So on that plan, you got to qualify for both Medicare and Medicaid. And when you have those plans, typically everything will be at zero for them. They don't pay for primary, they don't pay for specialists, and they rarely pay for medicines until this coming year. This coming year, some of those plans are going to end up having to pay $1 or $2 or $4 for their prescriptions, depending on the carrier again. But that's something that's going to change. And I remember last year when we made the change, people were like, "Well, I don't have a deductible." You will in 2025. People were shocked this year when the government said well, not the government, but the carriers added the deductibles in prescription drugs for most plans other than the dual plan. And in January, I told all my clients, but in January, I had several clients that refused to change, and then they called me saying, "Hey, why do I have a deductible now? What do I have $340? Why do I have $415? Why do I have $600?" Because I explained to you that it was changing. This year,
Right.
it's changing a little bit more in that the formularies are changing. They're getting a little bit more strict. And so you will need to really, really, I don't want to say really, really, but you will really need to look into how you are going to decide what plan is going to be best for you. You know, the agents can enter all your prescriptions and then find out what you might pay on a monthly basis or what you will end up paying under these certain plans. And you know, we're not here to try to change your doctor, but so we're going to work with you on your doctor. But sometimes your doctor is going to be in a situation where you're not going to be able to get the benefits you want under the certain plan because you're looking at this one doctor, and that's a different subject for a different day. Now, Sharon, the one thing also that people need to look at with their agent is the star rating. The U.S.
Okay.
government says that all the plans need to be star rated, and but they rate those plans. The clients rate those plans every year, and every time that they complain, every time that they call in to get service and stuff like that. So looking at the star ratings, if 1 through 5 is the star rating, 1 is being very, very bad, 3 is an average plan, and 5 is being the excellent plan. We don't have a star 5 like we had in previous years in the Valley, a 5-star plan. We don't have any right now. We're close. We have many companies that are very, very, very close to hitting a 5-star rating. But if you really want to look at a plan that's between a 3 and a 5, in my opinion, because those are the ones that are going to give you the best benefits and are most stable, and you're going to be able to get, you're going to be able to feel secure when you get that kind of coverage. But
That
you can,
makes sense.
yeah, you can go with a 1 and 2 star if you want. But again, I don't recommend that to my clients. But they really need to be looking at a higher star rating plan.
And where would they find that information at?
The agent is supposed to tell them when they are
Okay.
introducing the plan. They're supposed to tell them what the star rating is, and if they don't know, if they forget to ask, and the agent doesn't mention it, the book that the agent leaves behind, it's all in the book. Every single
Got it.
carrier is they're supposed to do it by law. Yes, they're supposed to present the star rating, but it's the agent's responsibility to explain to the clients, this is a star, this is the 4-star, this is a 3-star, whatever it
Okay.
is, so that they can understand. So I mentioned that you got to be 65 to get Medicare, and that's not entirely true. There are a couple of other times that you can get Medicare, and those folks, generally you qualify at age 65 because you've had 10 years of working. But there are some folks that can qualify for Medicare if they are disabled and they're under 65. If they are already disabled by Social Security, if they have Lou Gehrig's disease or ALS, and or if they have end-stage renal disease. And so if they do that, if they have those conditions, then they just need to visit with their Social Security office representative and find out when they would qualify for Medicare. On end-stage renal disease, my understanding is they qualify within a few months or a month or two. Being disabled, it does take 24 months of being disabled from Social Security in order to qualify for Medicare. So there's some timelines there that they need to get with those professionals and find out exactly what it's going to be. But those are other times that they can get on Medicare and be, you know, be covered. And again, you can always create your own account. Everyone can do that, and I encourage people to do this as well. I did it before I even became an agent with Social Security, and that's www.ssa.gov. ssa.gov. That is their website for Social Security. And create your account. It's going to be unique to you. You're going to only be able to log into that. And you want to take a look at that. You want to know what wages are coming into Social Security to make sure that they're being reported correctly, and to make sure that you are meeting the criteria for those 40 quarters. But most importantly, you want to make sure that that's the right amount that you are claiming, because this is how some people have found out that they had fraud against their accounts, because there was more income coming in that they were actually doing themselves. And they're going, wait a minute, that's not mine. I didn't work at this company. So, or I didn't have that income. So that's a big catch, if you will, for those folks if they have an account, so they can do that. Let's see, there are plenty of, we, like I already mentioned, the number of carriers that we have in the Valley. So do we have any questions or anything like that at this time?
So far, nothing. Just to comment that it was great information. So far, nobody's posted any questions.
Okay. So one other thing too that I've been told over the last 10 years, and it seems like I get asked this question every single year. Somebody will call me, inevitably they'll ask me when they're getting ready to turn 65, and they'll say, what's the cost to talk to you? How much do I got to pay for your meeting? And I get a little freaked out with it at the beginning, but now I kind of chuckle with it. I'm going, there is no fee. And they say, well, it's because this other person or this other agency was charging $50 for this, or $25 to me. No, that's not only not cool, but it's not legal. So there's not supposed to be a charge for this, for them to go and talk to an agent and find out what they qualify for. So those kinds of things are at no cost to you. And so you should be able to talk to an agent. It's best to make an appointment and talk to them in person instead of over the phone. So at least you can see things, you can
Sure.
understand things a little bit better. But I've been asked a bunch of times throughout the years, how much is it? Then the person does have to be licensed, and we have to be licensed with a life and health license that we have to take a class, and we have to pass the exam. Then there's another license, that's the property and casualty license, that you can't do health. But if you have both, which 5-Star Financial does have both, I have both licenses. The property and casualty is mainly your home and auto and your travel insurance, your pet insurance, things like that. So those are things that we offer as well. But that's on the other side of the license, if you will. And the other thing that I really like about our agents, and because we grew up here in the Valley, we are bilingual. So you're not going to run into folks that don't understand the language. It's really interesting at some of these meetings where I see the younger agents, and a lot of them don't speak Spanish, which I find kind of strange, but not really, because we didn't teach our kids to do that, but they're learning it now that they're getting a little bit older. So let's see. Oh,
That's difficult because there's a lot of Spanish speaking people in this area.
oh, there's so many. It's really, yeah. Because when I answer the phone, right away they'll say, "Habla español?" Sí.
Yeah.
Okay. Then they'll start talking to me. Otherwise, they won't. So I'm like, yes, I do.
Yeah.
I did want to bring up this other caution to you, to folks that may be shopping and stuff. And you're going to see agents at H-E-B. You're going to see agents at Walmart, Walgreens, CVS's. They are not allowed to make first contact with you. They can't come up to them and say, "Hey, you have Medicare. Can I help you with your Medicare?" They're only allowed to greet you, saying good morning, good afternoon. And if you decide to say, "What are you doing here?" or
Oh, I see.
then they can pursue the conversation. But like, I personally have been to Walmart or H-E-B, and I'm riding around my electric cart because of my knees. And then they'll ask me, "Sir, do you have Medicare?" And I'm like, "You're not supposed to ask me that question." But that's not, you're not supposed to be doing that. So first and foremost, they are not supposed to do that. You can do it if you want to talk to them, but we have agents at different locations, and that's one thing that right away we tell them, look, do not engage with them other than saying good morning, good afternoon. And if they come back and they say, "What is this?" and you can always offer them something free, which we do. We try to offer them information, or we try to offer them a free gift from whatever carrier we're working with.
Sure.
And then at that point, if they decide to say, oh, I have this policy or I have that policy. That's a different question. That now they've opened the door, and now we can talk about it. We have agents. That's a good question, Mr. Runghead. We have agents in Starr County that covers the entire Starr County. We have agents in Hidalgo County and McAllen that cover all of Hidalgo County, but they can also cover Starr County. We have agents here in Cameron County that cover all of Cameron County as well as Willacy County. So we cover the entire Rio Grande Valley. However, as I mentioned earlier, we do cover the entire state of Texas. Our license is a Texas license. So if we have friends or relatives that may be referred to us outside the valley that are in Texas, we can deal with them as well. And we do have, some of us have clients outside the Rio Grande Valley. But yes, we are located valley-wide, and of course we can do business statewide. I do have a license in Georgia as well. I'm a licensed agent in Georgia because I had some friends in Georgia that needed some help, so I got my license from Georgia as well. So I can actually operate and sell Medicare Advantage plans in the state of Georgia as well. But
Very nice.
But it's not something that there's other agents that have a lot more licenses than I do. I have friends in the business that have licenses in New York and New Jersey and Florida and things like that, and that's pretty cool. Besides having Texas, I just have a hard time handling the Texas one. So it's just a matter of whether or not they
A
want
lot
to.
of information. A lot of information.
It's very different too from one state to the next. You would
Yep.
think it's all the same, but it's really not.
Oh, no way. No
Yeah.
way. It's like, I mean, licenses are different from state to state.
Yes.
And it looks like Mr. Rangel has another question here. The first one was, where are your agents located? That when you responded to, he says, so the client has to initiate the contact with the agent when they are in the store location, and he puts without obligation.
Without any obligation. They don't have any obligation to give us their name even. And that's correct. They must initiate the question by saying, or even telling you, I have United Healthcare, or I have this other company, or I have that other company. And you can then the agent that's there may say, well, how is that going for you? Are you liking it? 9 times out of 10, they're having issues. That's the reason why they brought it up. I've been to a lot of those events, and most of the time when they just are walking by you and just saying good morning and maybe taking your free stuff and not really initiating any conversations because they're happy with their plan. And I'm glad that they are happy. However, even some of the happy ones don't have agents because they did it online. Folks that initiate their plan online do not have an agent. You may think you have an agent in some magical, mythical teleperformance area, but you don't.
Oh, wow.
You're going to have to deal directly with the company, and you don't have an agent. Now, sometimes we get questions from those folks saying, well, listen, I have this plan. And I'll say, who's your agent? Oh, I don't have an agent. I signed up online. Okay, well, then I encourage you to call the company. I'm not trying to be strict with them. I'll try to answer as best as possible. But the thing is this, if I sign them up or one of my agents signs them up or any agent signs them up, their responsibility is to their client. And so we shouldn't be trying
Yep,
to
I
give
understand.
them advice on a plan that we don't even have any knowledge of. It's that their agent should be answering that question. And so that's why they should go to their agent. And if you can't get a hold of your agent, then that's, again, like I said at the beginning, then give us a shout. But we'll definitely do our best to try to accommodate.
He has
So
another question here. He says, why is an Advantage plan better than just having Medicare only?
yeah, I was going to get to the Medicare only because we have folks that tell us, you know what, I'm going to just stay on Medicare, and Medicare. If a person just stays on Medicare Part A, Part B, they must get a prescription drug plan within 63 days of turning 65, or making that change. They have to do it within 30 days. So let's say they're already 68 or 69, they want to go to straight Medicare. So if they go to Medicare, now they have to get a prescription drug plan. That's going to cost them an additional 70, $80 a month plus deductibles. And so then the copays. So it's going to be more money out of pocket. But when you go to Medicare, you have the Medicare Part B deductible on an annual basis, which is, a little bit over $1,000, almost $2,000, and then you have to pay the excess of the 80% of the 80/20. So it's an 80/20 plan, and what I mean by that is the plan Medicare will pay 80%. The consumer pays 20%. So when you go to the doctor's office, you're probably going to pay 20% of the doctor bill. So if they charge 100, you're paying $20. But if they charge
Yeah.
$200, you're going to be paying $40 for that visit, and that's your
Yeah.
primary care. Then, if Medicare says that it's deemed to be unreasonable, let's say the $200 is unreasonable, then you're going to end up having to pay the 20%, plus you're going to have to pay the difference that Medicare didn't cover. Maybe they say it's only worth $100, so now you're going to have to pay the other $80 or $100 that wasn't covered by Medicare, or wasn't covered by Medicare, because they
Yeah.
didn't deem it to be reasonable. So there's a lot more money out of pocket, and so we don't
It's a big mess.
you do that unless there's special circumstances. And what I mean by special circumstances, very special circumstances, is if they are needing to consistently go to MD Anderson, and there's no plan that really covers them. MD Anderson changes a lot, and I've had clients over the years where MD Anderson just tells them, look, just get on regular Medicare, and we'll cover your costs, and things like that. So those are all on a case by case basis. I don't recommend it to people other than when they have special circumstances like that. So, but that's a great question, and
Yeah.
Medicare is just more costly. So when you have an Advantage plan or you have a supplement plan, that grabs all of those deductibles and copays and puts them all under the plan, and all you worry about is the zero monthly premium, if that's what that plan is, or your small monthly premium, and you pay the copays. So Medicare becomes your Medicare in a way. So you don't really have to worry too much about going out there and having all these additional costs, unless you have a different type plan. So there's various types of plans too. Our folks here in the Rio Grande Valley can have an HMO, they can have a PPO, or they can have the dual, which I've been talking about. So the HMO is going to be regionalized here in the Rio Grande Valley. They're going to have to see doctors that are in a network. They're going to get referred to doctors in the network, and they got to get a referral. So some people don't like to get a referral, and I understand that. So you want to get a PPO. If the PPO is good enough this year, coming up in 2026, then that might be an option for you. And the PPO is where you can go anywhere in the valley, you can go anywhere in the state, you can go as long as they take that carrier. So let's just hypothetically say Aetna, they have PPOs. They're known for PPOs. United has PPOs. Humana has PPOs. Cigna, which is now HealthSpring, has PPOs, or it has a PPO. So once you get a PPO, then a lot of people are happy with that. So the PPOs are going to have more out of pocket. You're going to be able to go more places, but you're going to have a higher out of pocket cost. And so it just depends, again, on the benefits that you are looking for as an individual, or that the family's looking for their mom or dad, or grandma or grandpa. And so they need to understand the differences. And again, we're here to be able to advise them what the differences are and what do they want to do. I often have times people come to my office and say, I want a PPO because I travel. Okay, cool. They come in and they get the PPO and they're going, wait a minute, about 3 or 4 months into it, they're like, I'm paying too much money out of pocket. Get me back to
Yeah.
I'm not going anywhere. It's
Yeah.
still too late after 3 months. And that's another thing the government's doing this year. You're really not going to be able to make changes once you do it. You can just be able to do it once a year, which is your annual change. So we need to think about those things, and you need to think about them very, very closely before you get into that. So another thing that we do here at 5 Star Financial is we host Medicare 101 seminars. I've posted an eventbrite.com all the Medicare 101s that we're having here in the Harlingen office. We're having a total of 10, or we've already had 2. But my conference room is limited, so we can hold up to about 12 or 13 people comfortably. And so they're at 5:30 to 6:30 p.m. And for those folks that are turning 65, or folks that still have questions, maybe they turned 65 last year and you have questions about how Medicare really works, come on in, or make a reservation with us, RSVP to our office, and give us your name and phone number, and then we'll put you down on the list for whatever date there are. Like I said, go to eventbrite.com. If you also go to our website, which is 5 Star Financial, it's on that paper, 5starfinancial.com. If you go to our website, it's also posted there as well. And so you could put in your RSVP for the Medicare 101 plans or seminars, which are really informational. and they're only 1 hour. And so we'll squeeze it all in, unless we have a whole bunch of questions. It might be a little bit longer. This last one I did was a little bit longer than an hour, but just be prepared that when you go see your agent or anywhere you go, is just to make sure that you have an idea as to what you want, as far as benefits. You need to be able to say, listen, right now I'm paying too much on medications, or I don't like XYZ. So that way the agent can know what direction we need to go and what carrier we need to go with. So there's a lot of things that go into making sure that they're happy with their plan. So they get enrolled in annual enrollment period coming up October 15th through December 7th this year. And if they don't like their plan, if they made a change and they don't like their plan, we can change them January 1st through March 31st. That's open enrollment period. For those individuals who made the change during annual enrollment, they can change to another company that's the similar or a lot like it, as far as brand, if you will. We can make a change for them and put them on something different if they didn't like it. So they have an opportunity to go back or go to another company if they desire to do that. If you don't make a change in AEP, you say, I'm fine, I want to stay right here. You can't do that in OEP. Those individuals are not allowed to do that unless they have a supplemental enrollment period. And there's 7 criteria there that they need to be aware of. Primarily, it's the top 3 are going to be, you moved out of your area. Like I left from the Valley to Houston. Okay, that's a supplemental enrollment period. You're allowed to change plans anytime during the year. The other one is you had a health change. So for those individuals that are on a regular Medicare plan, like I said earlier, and they get diabetes or have some other issues that qualifies them for a chronic plan, boom, they can change plans. Or they moved more than 50 miles. So being here in the Valley, if they move from Starr County down to Brownsville or Brownsville to Starr County, they may qualify for that because it's over 50 miles. So there are some opportunities to do that. But moreover, or the most important thing is that most people don't realize that they can't change as often as they used to, because there's been a lot of
Yeah,
new rules. And
it
people think, well,
changes.
I used to be able to do it all the time. It's not the same anymore. And they don't
Yeah.
want to believe me, so then they'll call somebody else, and then and I understand the idea of, well, I don't want to believe them because that's not the way it's been. But there's been a lot of changes, and there's going to continue to be changes, unfortunately, because there's just a lot of rule changing going on in Washington that's causing these changes for us locally as well. So they can have supplements, like I said before, the supplement plan if they want to do that. The Medicare supplement, the main thing between that and the Advantage plan, if they do travel, if they are 65 to 70 and they are going to be traveling to go see grandkids or kids or what have you outside of the state, a Medicare supplement plan is monthly, a fee. You got to pay for your prescription drug plan. Keep in mind, you do not get prescription glasses, you do not get dental, and you do not get hearing aids. But anywhere you go in the country that takes Medicare, so if you go all the way to Washington, you do not pay for a doctor visit, you do not pay for a specialist visit, you do not pay for a hospitalization, because you're paying monthly. So it's almost like when we had a job and we had our employer had coverage, and we just went into the doctor. It's really a great plan for those individuals that are constantly traveling. But what we have found is that with the travel, at some point they say, you know what, we don't want to travel anymore, and we just want to stay in the Rio Grande Valley, and we want to find something that's going to be less expensive than $400 a month. So we can get them on probably something a lot less. This year,
Something happened with your picture. I can't see you anymore.
I still see me on the screen. I don't
You
know.
do?
Yeah, I see me and you, actually.
Hmm.
I know that right now
Oh,
I
see.
lost both of us, but then you came back and then I came back. But I see me and I see you. I see you.
Okay.
Um, I don't know if the folks that are on can see both of us, but I don't know. It's a little.
I don't know.
Um, and I was just
Can you
thinking about
guys
that.
see both of us, or is it just me who can't see him? Because I don't see him.
I'm getting thinner
Ray,
by the minute.
Ray, Ray put, I cannot see him either.
Oh boy, I'm sorry about that. Um, huh? I don't know what to do.
Oh, Jesus. I mean, I can hear you fine. I just don't see you.
Yeah, I would like to take. I'll try to take a picture real quick and show you that
No, I believe you. I just see a black screen here. I was like, wait, it's like you disappeared all of a sudden. Oh, there you are.
Okay, all right, cool. Because I saw it blink and then come back. There we go. All right. Well, so we're back. So
Yeah.
on the Medicare supplements, I will add this comment. Some of you all may have been hearing the news lately about costs going up, and we've been hearing the same rumors. And so there's some folks in the business that have been talking about the pricing going up tremendously for everyone who's on a supplement. So I will tell you that there's a lot of companies out there that like to offer introductory pricing for say $99 a month or $125 a month to people to get on a supplement. That's for your first year. And then they go up and then they go up and they go up and they go up and they go up. What I've experienced over the years, the last 10 years, is that United Healthcare's Medicare Advantage plan has been stable for the last 25 years. And what I mean by stable, it's not that they didn't have increases, but their increases were less than 5% overall on a 25-year. If you plot it out for 25 years, if you look at the chart versus all these others, versus, and I don't want to name any names, but there's quite a few out there that offer these plans. So at the beginning, you may think, okay, United Healthcare is a little bit more expensive if you're just turning 65 or you're 66. So you want to go ahead and get on a plan that's going to stay stable. I always recommend that you want to be on something that's not going to be jumping around on you if you're going to do a supplement. So if you are turning 65, let me give you some advice as well. 6 months after your 65th birthday, you still can get a Medicare supplement. For the Medicare Advantage plan, it's a little different, right? So you have 7 months, 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65 to get on a Medicare Advantage plan and get your Medicare. But when you try to get a Medicare supplement, you have 6 months, you have that time frame as well, but you have 6 months after your 65th birthday so that you can get a supplement plan that will not do a medical exam on you. So you basically get in for free. Like they don't qualify you, they don't pre-qualify you, which is really nice. You don't have to do any kind of medical exam, no tests, no nothing. However, if you get a Medicare supplement and you're going to change from one company to another or one plan to another after that time frame, you are subject to underwriting with whatever underwriting procedures are, and your rates will probably go up based on your current health conditions.
Oh.
So when people say I'm going to move from this plan to that plan or this plan to that, and they do that, they end up going through a underwriting, and then their plan jumps up, and then they're like, oh boy, I can't afford that. I was only paying $200, now I'm paying $490. That's crazy, and I agree, it is crazy. But that's how they get you is when they tell you they're going to do this or that. So one other thing that's changing this year, you may recall last year, the prescription, the whole arena with the prescription drugs changed. Before last year, before 2025, we had about an $8,000 amount of money that people would get their prescriptions, and it would go into this pot, and it was more like you got into a donut hole, right? You get into a certain
Oh,
point,
yes.
and people fell into the donut hole, and they had to pay more for their prescriptions, and they did that for years. The donut hole went away in 2025, and that was a good thing. So that meant that what happened with the donut hole is they did away with it, and they said the maximum out of pocket in 2025 is going to be $2,000. So when people have the first $2,000 that they spend on prescription drugs, then after that, all their prescriptions are going to be free or at low cost, like maybe $1 or $2, but it's going to be in the catastrophic phase. So what all the companies call catastrophic phase. So when they do that at the $2,000, that's pretty good. Although some people were a little bit more affected because they had, not only did they get the $2,000 reduction, but now they got deductibles with their companies. So now they had to get $600. The first $600 in January was out of pocket. And a lot of people were upset about that. I don't have $600 to get my prescriptions because they're expensive. Understood. So they implemented a plan, the government did, that said, if you want to prepay or pay over time, like get a contract with this with your carrier, they would allow you to pay a monthly fee, let's say $125 a month. They would take the $2,000 and divide it by 12, and then that's what it would, whatever it came out to, that's what your monthly fee would be, and you would have no copays at the pharmacy. You already reached your $2,000, and you were done with that, so that you can get all your prescriptions at that point without having to worry about what it costs. That's a really good plan. Unfortunately, a lot of people here did not want to do that. They said, I don't want to pay $125, and that's fine. I actually ran the numbers for a lot of my clients, and it didn't work out for them. It was probably better. It was more beneficial for them to stay outside of that plan because they weren't going to meet the $2,000.
Yeah, the $2,000 anyway.
But there are people that do meet the $2,000, right? Well, this year it's going to jump up to $2,100, so it's going to be an extra $100 out of pocket, and that's because of the Inflation Reduction Act of this year. But that's also the Inflation Reduction Act is pushing the prescription drug plans, the independent drug plans, to increase in cost and decrease in the amount of money that they're actually going to be covering for the drugs. So it might be best to be on a Medicare Advantage plan. That's something that is not going to be affected yet. Hopefully not ever. But that's what the plan is for 2026, is for it to not be affected by it. So we're looking closely at all the different rules as they come, and trying to hear the interpretations, and we read the rules and the laws and try to interpret it ourselves to see if it meets what they're saying, and then if we don't, we have questions, and we all of us, all the agents in the Rio Grande Valley, we all have people we can always ask, what we call our upline companies, and we call and say, listen, hey, this is a situation, what do you think? And then they'll give us their expert opinion on those things. So it's not, we're on top of things on a regular basis, and a lot of my colleagues are throughout the Rio Grande Valley and throughout the state of Texas. It's not just Five Star. I mean, I'm not trying to say that, but I am saying that I am aware of unethical situations, and we're not allowed to say anything. We can't complain. I can't complain against another agent. The only people who can do that are the people that are personally affected by it, which are the clients. And it's unfortunate because they don't want to do it, because they're just like, no, mijo, I'm going to let it go. No, it's okay.
Yeah, no, I understand.
So, and it's okay. I mean, that's their prerogative. So I think I've covered everything that I was going to cover. I don't know if you want me to repeat the websites that I gave out, or.
That's good. We can repeat the websites. That's not a problem.
Okay, so for Social Security, for Social Security office, you can go to ssa.gov. That's with the triple-W in front of it. And that's where you'll go to do for your low income subsidy, or LIS subsidy. You'll go to Social Security as well. If you want to try to find out if you qualify for Medicaid, you're going to go to triple-W I don't know. I had it right here. I don't want to give that wrong. Hold on. I'm sorry. Yeah, sure. It's www.yourtexasbenefits.com. And when you go there, you're going to the website for the Texas Department of State Health Services, and you're gonna apply for Medicaid if you feel that you may qualify for that. And it doesn't hurt to try to get the qualification. And then the last website that I want to share is the Five Star website, and that's www.5, the number 5, Starr, STARR, and then financial.com. And on our website, you can see all the stuff that we have. You can see all our agents, the locations of our agents, our phone numbers of our agents. You can actually make appointments on our website. You can see the posts that are going onto my Facebook page. And I post probably about 7 to 10 times a day on my Facebook and my Instagram page with different advertisements, different things that's going on, different meetings, just talking about different stuff that we have going on. So it's a unique business. I love this field. I love the fact that we get to work with the folks that we work with, because in my opinion, a lot of times they are kind of left out and it's not by chance or not by choice. Sometimes, it just happens. But then there's a lot that don't have anybody to talk to, and they'll call and say, I need to talk to you, or can you come by the house and visit? And we do all that. We can. But there are certain things that we can't do, which is, be a provider, because that's something else that happens. They got to qualify for other things for that. We're not
Sure.
providing. But man, Sharon, I feel like I did all the talking. Nobody asked any questions. Well, except a couple of questions.
I think, what part of the problem was is that I had been out for the last two shows, because usually we get a bunch of questions and at least comments, but
Yeah.
I think it's just because I've been out. I mean, I was out. And so I'm not, I mean, I posted it on Facebook, but I think people are just have to get into the groove of me like coming back and stuff. It takes a while for people to, you know, like,
If
oh, she's back or whatever. It's just,
if somebody
I
sees
think
this,
that was probably it.
if somebody sees the recording, do you see the questions as well after the fact? Because maybe you could forward those.
No, because
Oh, okay.
no, well, actually, let me take that back. I can see them if it's on Facebook and you're tagged on Facebook, so you'll
Right.
be able to see them as well.
Okay. Okay.
On YouTube, no.
Okay.
But the thing with Facebook is they erase the videos after a month. So that's why I don't advertise the Facebook component, because after a month, it's gone.
Oh,
On the YouTube, it's there
forever.
indefinitely, or at least, a long, long time.
Sure.
So,
Sure. No, I didn't know you were on Facebook until you tagged me. I mean, for the show. I mean, I just thought it was
yes,
a YouTube show, and and I
yeah,
saw that. I was like, oh, okay. So that's awesome. But no, I do appreciate the opportunity to come on and do a little bit of explaining. Um, I
absolutely.
I know I get winded sometimes, as far as I can go on and on and on about the subject, because I just happen to know a lot about it. Somebody asked me something the other day, and I
Sure.
just went on and on and on, and they're going, I have to go now, and I'm like, I'm sorry. So
Wait, I'm
I,
not finished.
I
Yeah,
didn't even
I
get to ask
get it.
a question, but no.
Yeah.
So
No, I know, when you just know so much about the topic, there's so many things that you feel are pertinent that you just kind of keep going and going. And I honestly can relate, so I completely understand.
there's so much
And
that's
this is an
important.
important topic.
Yes, there's so much that's important with it, and that's why I encourage them to get with their agents, visit with their agents. Calling them on the phone just doesn't really do very well. If you can't meet them at their
Sure.
office, and because I do have clients in Starr County, and they don't want to come all the way to Harlingen. And I understand that. I'll try to make an effort to go to Starr County, or they'll tell me, so okay, I'll just meet you in McAllen, so that way they can have an excuse to come to McAllen.
Sure.
We'll meet in McAllen or something like that, and that's not a problem. But if all else fails, I will make a home visit. That's not a problem, because that's, after all, that's what it's all about, is making sure that the client is happy and comfortable in the environment that they're going to be in. But
Absolutely.
but this AEP, or annual enrollment period, our agency or our office is going to be responsible for, man, it's 54 or 54 days of AEP that we have. And so we work 7 days a week, and we're going to have events almost every single day, multiple times a day. So we're having a little bit over 200, or just around 200 events going on in 54 days. So we're going to be busy, and we're going to be around. So we
Okay.
look forward to
No
seeing.
worries. And we can always have you back. There's a bunch of updates and stuff that need to be happen. Reach out to me, be like, you know what, there's a lot of updates, there's a lot of changes. I think
Okay.
we need to talk about this. You can come back,
Okay.
so we definitely, this is important stuff that people need to know. So,
Awesome.
we can do that. And we're pretty much about the hour. Do you have any last minute things that you want to put out there?
I just want to thank you very much for the opportunity to be able to come on and give this brief explanation of the different points that we have about Medicare and our Medicare clientele here in the Rio Grande Valley and in the state of Texas. And I think you're doing a great service with that. And I look forward to coming back on, maybe at the end of AEP or something, and talking about what the next steps are
Hey,
for everyone. So we can
yes,
definitely do that.
absolutely.
So,
Message me, and definitely let's keep in touch. I
okay,
mean, you're my mother's agent anyway, so it's not like we don't keep in touch.
that's true.
Plus I do refer to you anyhow.
Yes.
So we're in touch anyway, but I mean in touch regarding another follow-up show. I have no problem with it.
Okay.
Well, guys, it looks like we're pretty much about the hour. We are Gold Rush House Solutions. Again, Let me be a community resource. You can contact me via Facebook, send me a message through Messenger, or text me at 956-640-6963. Don't call. If you call, I don't answer any phone calls. So only text messages. We offer a variety of services. You can go to my website and have a view there, just to get some general information. But other than that, that's essentially it.
Okay.
And Ray has a last comment here. He says, what if you don't know anything about all this stuff and feel like it's too much to learn and make a decision? That's what Mo is for.
Well, Ray,
You know,
that's
he's basically helps you understand all this. He's somebody that I use as anybody that I have patients. Like I said, he's who I use for my mother. You I love texting, but you can call, basically text them and like, I have these questions. What do you think about this? What do that's the whole point of the agents. You need to have somebody that you trust, that's dependent. And I have found that in him. So, if you have questions or concerns, give him a try and see what you think. But he's extremely knowledgeable.
thank you, Sharon.
Alrighty, guys. you know, we're at an hour, and so we'll see you guys next week. And hopefully get back into the groove of, having our shows and stuff. But again, thank you for being patient during the time that I'm out. But we'll see you next week. So good night, and thank you for your time.
Thank you. Have a good evening.
You too. Bye bye.
Bye bye.